I'm concerned about using too much cannabis. What if I overdose? Hi, I'm Dr. Dan Stein, board-certified neurologist and medical cannabis expert. We're going to discuss this important concern today. Patients in the clinic ask, if I use too much cannabis, what will happen? How will I know, and how do I cure myself of that potential side effect? Well, there's two things I'd like to address today on that. Number one, in all of recorded history, it does not appear as though there have been any deaths from overdose of cannabis by itself. Patients that are using cannabis plus other intoxicating substances do run the risk of overdose and death. But cannabis by itself is not likely at all to cause any major side effects because the cannabinoid receptors in the brain are primarily located in the frontal cortex and motor systems of the brain, not in the brainstem, the area that's critical for respiratory control. Patients that are using opiates or benzodiazepines like clonazepam or alprazolam Xanax do run the risk of depressing respiratory drive because the brain's receptors for those opiates and benzodiazepines reside in the brainstem. Overdose of benzodiazepines and opiates is tragic and way too common. Fortunately, that does not happen with cannabis therapy. If patients do too much cannabis therapy, they do have problems. It can cause problems with oversedation, incoordination. Clearly, it can cause problems with paranoid reactions and even hallucinations. But these are temporary side effects of cannabis therapy that last only as long as the cannabis is lasting in the body. For example, when you inhale cannabis, the effect lasts about 3 hours. Ingesting cannabis results in about 6 or 7 hours of effect. So, if you are having an unpleasant reaction from cannabis, it will wear off. It won't kill you. And there are some ways to help reduce the harm associated with those side effects by just staying calm, drinking water, talking with someone who may have more experience with cannabis. The vast majority of patients who do too much cannabis do not need to go to the emergency room, and in fact, that even makes the experience more unpleasant. I think the only real reason to visit the emergency room from a cannabis overdose is if you're having a drop in blood pressure. That does happen sometimes, and there are some patients who have cardiac conditions who are at risk of having problems with low blood pressure if the cannabis dose is too high. So we address this and other concerns here in the clinic. And you're probably watching this video because you have your own questions or concerns. So please, if you are a Florida resident, seasonal or permanent, and would like to reach out to us, we are available to answer your question. Please email info@neurologyofcannabis.com or call 941-400-1211. I'm Dr. Dan Stein. That's our video for today. Thanks for watching.